So we're going to use moxa, which in Ayurveda we would call Agni Karma. We're going to do a little self-care protocol of how to work with heating the points. So we're going to start with the elbow. And so if you come to the elbow, we learned corpora and Baha'i corpora. You could, if you have elbow pain, golfer's elbow, tennis elbow, just kind of do like a moving moxa technique here to work on the entire joint. So you could do that for any joint or any area. In particular, this is not a Marma point, but in the TCM system, there's a point here called large intestine 11. So we would come to this Baha'i corpora at the lateral epicondyle. You see the elbow crease, and large intestine 11 is just halfway between those. So I'm just going to bring my moxa stick, hold it steady right at that large intestine 11 point. As soon the heat will build, as soon as it feels like it's too hot, you just simply move the stick away. We're going to do that 3 times here, holding the heat steady. Whenever it gets too hot, moving it away. This is an excellent point for the immune system, and what I'm going to show you today is a little immune protocol. So heating that point 3 times, and then moving it away. We can do a little moving moxa technique, where now I'm just going back. I'm just going to go along the arm. If you had arm pain, wrist pain, tendonitis, just going up and down the arm is a nice soothing technique here. And then the next point I'm going to do is Angushta Mula. So we found this point between the thumb and the index finger at the center of the bulge, or right in the center of that depression. So I'm doing Angushta Mula with my moxa stick, holding it steady till the heat gets too hot. As soon as it's too hot, I'm going to pull that away. So usually I do about 3 or 4 times on any of these points. You could always do more. You could do less. The heat should feel nice and soothing there. As soon as it's too hot, pulling it away. If you had arthritis, any pain in the joints, for example, you could do that moving technique. Feels very soothing along all of the fingers. Just going up and down all the fingers, repeating that as many times as you like. You would do the same protocol on both sides, right and left, to balance. And then I'm going to continue to some immune points on the leg. So right below the knee, if you place your hand, this is about 3 anguli below the kneecap. Here's the tibial bone. And you're going to come 1 finger distance lateral to that. This is stomach 36. And I'm bringing the moxa stick right to that stomach 36. This is one of our biggest points for the immune system. Holding the heat steady. As soon as it's too hot, pull it away. Repeating that 3 or 4 times. Once again, any joint, you can do that moving moxa around the joint. That heat is going to be soothing for that entire joint. You could also do this moving moxa technique down any channel or meridian, down the limbs. That just creates a nice soothing effect there as well. The next point I'm going to do in this immune protocol is near the ankle. And so I'm coming to the medial malleolus here. I'm going to place my hands once again to measure about 3 anguli, and I'm coming to a little depression there right after this crest of the tibia. I'm holding the heat steady until the heat builds, gets too hot. As soon as it's too hot, pulling it away, and then repeating that 3 or 4 times. Sometimes the heat can build quite quickly. So that would be the immune protocol used in TCM, is this large intestine 11 by the elbow, the Angushta Mula, the stomach 36 here, and this point here is spleen 6, those 4 points. So you would do it on one side, then go ahead and do that on the other side to repeat protocol.